All right. Well, let's get started, everyone. Thank you so much for being here today. I'm Danielle Ramo, and it is a pleasure to welcome you all to the second ever National Fentanyl Awareness Day. This activation is to spread awareness and information about illicit fentanyl use and overdoses. This session that we're having today is the first in a 5-part series that will take place throughout the day today, covering an array of topics and perspectives related to the illicit fentanyl crisis. We are excited to kick off today by talking about what parents need to know about fentanyl poisonings and overdoses. We're also going to talk about how to have healthy, realistic conversations at home about these topics. We're deeply grateful for the day's 700 plus organizational partners who have signed on to spread the word, and for the team of experts, 2 of which we have with us today, who have lent their knowledge and time to make this day possible. Without them, we couldn't do this important work. We've had overwhelming registration for this event, so if this topic is on the forefront of your mind, you are not alone. We've brought together this morning or this afternoon, depending on where you are, 2 world-renowned adolescent medicine specialists who will share the facts about fentanyl and strategies that you can use at home and in your communities, and then we will answer your questions. Please feel free to put your questions in the Q&A box during the webinar, and we will get to as many as we can. With that, it is my pleasure to introduce our 2 panelists today. First, Dr. Hina Talib. She's a pediatrician and adolescent medicine specialist and mother of 2 children. She leads adolescent medicine at the Atria Institute, a primary and preventive care center in New York City. She is also the co-founder of Thread Health, the first digital health service for adolescents and young adults. Dr. Talib is an associate professor of pediatrics at the Albert Einstein School of Medicine in New York City, and she is a regular contributor to media, including being a spokesperson for the American Academy of Pediatrics, and her work and perspectives have been featured in outlets such as the New York Times, the Wall Street Journal, and CNN. She shares parenting and adolescent health advice on her popular Instagram account at TeenHealthDoc. And Hina, it is a pleasure to have you here today.
Thank you for having me.
Next, we have Dr. Scott Hadland. He's the head of adolescent medicine at the Massachusetts General Hospital and Harvard Medical School. He's a teen addiction medicine specialist whose clinical and research interests are in the area of preventing and treating drug and alcohol use, especially among those in the adolescent years. Dr. Hadland's work has been funded by the National Institutes of Health and the Centers for Disease Control, and he has been published in the New England Journal of Medicine. His commentary and work has been featured in the New York Times, the Washington Post, CNN, NBC, NPR, as well as other popular news outlets. And this year, he was selected to the Presidential Leadership Scholars Program, which brings together national leaders committed to facing critical challenges in partnership with both the Clinton and George W. Bush presidential centers. Dr. Hadland, it's a pleasure to have you here today.
Thanks for having us.
I'm Danielle Ramo, a clinical psychologist, adjunct faculty in psychiatry at UC San Francisco, and chief clinical officer at Be Me Health, a mobile platform that supports the mental health and well-being of all teens, created in collaboration with an over 100-member nationwide teen advisory board. I've spent my career researching, writing, and speaking about teen substance use and mental health in the digital age. As a mom of 3 who are almost at the age where they're starting to hear about fentanyl, I know firsthand about how scary this issue is for parents and families, even for those of us who are keenly aware of the facts. I'm dying to hear more about how these 2 experts recommend we address this issue in our homes and communities. So let's dive in. Data from the Yale School of Medicine cited that more than 1,500 kids under the age of 20 died from fentanyl in 2021. That's 4 times as many as just 3 years earlier in 2018. Many of the fentanyl deaths among children and teens occurred at home, and the vast majority were accidents. Scott, I'd like to start with you and have you share a little bit about what is explaining this increase in deaths and how we can understand better the fentanyl crisis in teens today. What's the difference between what we might see in the hospital and what's on the street? And why are overdoses so dangerous?
It's an incredibly huge issue. It's one of the biggest public health issues of our time in the world of pediatrics right now. We're at a point, just to add another data point to what you just said, where overdoses now kill the equivalent to a high school classroom of teenagers every week across the United States. And if we look nationally at what's causing these deaths, it's really fentanyl. And so I've got a few slides here that I just want to use to kind of level set at the very beginning. Before I jump into the slides, though, let me just spend a quick minute talking about what fentanyl is. So fentanyl is an opioid. It's an exceptionally potent opioid. So it's similar in pharmacologic properties to heroin or to prescription pills like oxycodone. But it's very potent, and it's at least 50 to 100 times more potent than is, say, heroin. And so because it's so potent, it puts young people, or really any person who uses it, at very high risk of overdose. And unfortunately, the fentanyl that is out in the community right now is in sort of surprising places. So the fentanyl that has flooded our drug market is not the fentanyl that I, as a physician, might be prescribing to treat pain or that anesthesiologists use as part of their surgery. It's fentanyl that's been illicitly manufactured and brought into the United States. And the places that it's popping up most commonly are in counterfeit pills, which I'll talk about in a moment, but then also in other parts of the drug supply. For example, cocaine is increasingly tainted with fentanyl. And so people who are intending to use one substance are inadvertently exposed to another with a high risk of overdose. So let me just spend a few moments, as I said, just kind of level setting and talking a little bit about some of the data nationally. So this figure here just shows what has happened to teen overdose deaths across the United States. So this is a figure published last year, and it looks at data from the year 2010 on the left to the year 2021 on the right. And it shows the rates of different drug overdoses in teenagers across the US, with that gray line that has this sudden upshoot during the COVID years being attributed to fentanyl. So we're going to talk a lot today about fentanyl, it being Fentanyl Awareness Day. But this is really sort of the reason that we're alarmed, is that there has just been this skyrocketing number of teen overdose deaths that involve fentanyl. Next slide, Danielle. And as I said, a big part of this has been that many overdose deaths are driven by these counterfeit pills. So what I'm showing here are pictures from the US Drug Enforcement Administration, and it shows right next to each other real and counterfeit pills. So on the left, the top blue pills are real tablets of oxycodone, which is an opioid that's prescribed by doctors and is a painkiller. Immediately underneath it are fake or counterfeit oxycodone pills that are sold in the market. They have not been prescribed by a doctor. They haven't been dispensed by a pharmacy, and they actually contain fentanyl. And because fentanyl is an opioid with some of the same sedating and pain-killing properties as oxycodone, you could pass these pills as being like oxycodone. But the amount of fentanyl that's in them is often far too much for a person and can cause them to overdose. The middle panel actually shows fake Adderall tablets on top, and underneath it, real Adderall tablets on top, and underneath it, fake Adderall tablets that contain a different drug, methamphetamine. And then the right panel here shows a white real tablet of Xanax, an anti-anxiety medication, alongside a fake yellow tablet of Xanax, which actually contains fentanyl. Again, it causes these same sort of sedating properties and can cause someone to sort of feel relaxed. But because this has been elicited on the illicit market, has been manufactured on the illicit market, the risk of overdose is really quite high here. Next slide. And so with this as a background, it's worth knowing that national data tell us under what circumstances young people are overdosing in the United States. So amid this skyrocketing number of deaths attributable to fentanyl among young people, most overdoses are occurring at home. About 2/3 of the time, there's actually also someone else at home who could have responded in that moment. But most of the time, by the time paramedics arrive, the teen has already died. And in fact, This shows a real opportunity for intervention here. Naloxone, also known as the brand name Narcan, which is the overdose reversal agent that can save a life in minutes when it's sprayed up the nose of somebody who's had an overdose. Naloxone is actually given in fewer than 1 in 3 teen overdose deaths, showing a real opportunity here for us to get Narcan into people's homes to address these overdose deaths where they're occurring. Next slide. And so this is the last slide that I want to present before we get back to our discussion. Again, in service of getting us all on the same page, understanding ways that we can help prevent overdose in teenagers. Things that I want parents and teens to know are, first of all, to just be aware of these counterfeit pills that are laced with fentanyl, as well as heroin and cocaine and other drugs that can have fentanyl in them. We want teens and families to understand that people who are using substances shouldn't use alone. So, as a pediatrician, I make the recommendation and I counsel young people not to use, but I also want them to understand that if they do use, here are the ways to keep themselves safe. So don't use alone. If a teen is going to use one of these pills, start with a very small amount to assess its effect, because it could be highly potent. To avoid mixing pills with other substances. We call this polysubstance use, especially alcohol and especially medications like benzodiazepines, which are medications like Xanax or Klonopin, which can increase the sedating effects and contribute to an overdose. I want teens and parents to understand that if they do have somebody who overdoses around them, that they should call 911 immediately to make sure that person gets medical attention. And then last of all, I want to make sure that teens and families have naloxone around. And we can talk about how to get naloxone in a moment. Naloxone, again, is the overdose reversal agent. It's in this picture here. It goes by the brand name Narcan, and sprayed up the nose, it can save a person's life when they're having an overdose really within minutes.
Thank you so much, Scott. I do want to talk a little bit more about Narcan and what specifically we can recommend that parents and families do around having naloxone available in their homes. Before we get there, though, I'd love to hear a little bit from Hina, specifically around your take. What are you seeing and hearing around the fentanyl crisis in teens today? Help us understand how much, I'm sure there's a lot of overlap with what Scott shared around the dangers, how teens are obtaining and are at risk of overdose today. What more can you share with us about what's out there and what you recommend to families?
Yeah, thank you. I think that as a pediatrician, it's really alarming the rate of increase of deaths by drug overdose or poisonings. And so we look at we look at trends, and if we look at the trends as folks have since 2019, the rates of deaths by drug overdose and poisonings have gone up 76%. That's a huge trend line. And then if you look at of those, how many had involvement, how many were from unintentional poisonings, 110%. And so really now we're in a situation where deaths by drug overdose or poisonings are the third leading cause of death in adolescents and young adults, and just following gun violence or firearm related injury and motor vehicle accidents. And so this is super important now because we're seeing a change that is alarming, and pediatricians all over the country, our eyeballs are on this. And as parents, our eyeballs are on this too. So this is very important right now. It's a big change. And then the other important point to remember or to know is that fentanyl is actually very easy for adolescents to encounter, even if they're not looking for it, because it is out there. And so even if they're not intentionally planning on using fentanyl or don't know anything about fentanyl, we need to start talking about it because it's out there in the drug supply. And so for those reasons, it's very, very important to talk about it right now. In terms of what I'm hearing, I hear from adolescents and their parents through media, through my work in New York City, it reflects the data. I hear about people who have lost children, who have lost young adults, or who have lost friends in their community from this. And it is heartbreaking. And I hear about it commonly, like once a week now. And it's often it was somebody in the classroom or in the school community. And so it was sort of, parents are looking for guidance on now what, it's come close to home. And so it becomes very, it moves you as a pediatrician when you not only see the trend lines and see the data that quite frankly are frightening and eye-opening, but then you're also hearing about it a lot more. And perhaps people who are listening here have heard about it or have been touched personally by it. So we are here to help right now.
I hear you both loud and clear that fentanyl awareness is something that we should all be thinking about, and also that illicit fentanyl use is a public health crisis that affects us all, and we should all be paying attention to this. And yet, I also think there is an idea that opioid use and opioid addiction is something for other families to worry about, or something that I don't need to think about in my home, or that doesn't affect my school and community. I'd love, Scott, to hear from you a little bit about the pathways through which teens that you see in your practice or see out there generally are starting to use fentanyl. Are these teens who are having an issue with addiction to prescription medication and then move on to illicit use? Are these teens who are trying to obtain drugs recreationally on the illicit market and accidentally find fentanyl in something else? What are some of the main pathways that parents and families need to be aware of?
Well, I think every family needs to be worried. I don't think that this crisis is leaving anybody behind, unfortunately. And so opioid use and experimentation in teenagers cuts across all kinds of different categories. It cuts across race and ethnicity and language and socioeconomic status and neighborhood. And so every family from every corner of this country needs to be aware of the risk of fentanyl overdose. And there are different pathways, as you say. So many parents are unfortunately surprised to learn that their teen is misusing a substance the first time that they overdose, right? That could be the moment that you first learn about this. And particularly in a world in which fentanyl is everywhere, it's cheap. It's often being sold on social media and other places that teens are without us necessarily having sort of full monitoring capabilities over their lives. Teens can get a hold of this and just experiment with it. And because fentanyl is so potent, it really is the case that just a single exposure could kill a young person. And so every family needs to be prepared to know what an overdose looks like and be prepared to respond. But yes, as you hinted, there are other ways that young people will sometimes start to struggle with fentanyl. Many teens have mental health problems like anxiety or depression, or have pain concerns that go unaddressed by physicians. Unfortunately, getting mental health care or getting pain treatment for young people in this country can be very difficult. And so a teen with untreated or unaddressed mental health or pain concerns might turn to a pill that they find on social media or that a friend offers them, and that puts them at risk. And then there are some teens who also struggle with addiction, who may be using different substances, maybe using opioids, and they know that they're using fentanyl and they're struggling and they're unable to stop. And we need to be poised and ready to help every single one of those youth that I just talked about.
Scott, I'd like to drill down just a little bit into the pain concerns you talked about, because I think that's a pathway that isn't addressed very often in the public discourse on this topic. How might a teen find themselves in a pain experience? I can imagine sports injuries, for example, is one of the more common pathways. And if there is a pain concern or an unaddressed mental health concern in the home, if a teen themselves is worried that they're struggling, or if a family is worried that they're struggling, what are the ways that they can get those pain or mental health needs addressed before it comes to the pathway of using substances to address these concerns?
Yeah, when it comes to pain, you're right. Many people will experience ongoing pain because they've had an injury, or they may have a chronic medical condition that puts them at risk of having chronic recurrent pain. And so it's up to us as pediatricians and doctors to make sure that young people with these pain concerns get treated. One thing that I worry about too is that, when pills are sold on social media, sometimes it's done so in a way to help a young person relieve pain that they may have that's not related to a medical condition, right? So somebody who may be lifting excessive weights and wants to be able to push through, and so tries a pill as a way to help address their pain, that doesn't even involve a physician at all. So there's a few different ways that this can happen, and we need to be aware sort of all of them. And I certainly have seen all of these in my own practice as a pediatrician doing this work. The thing that I want teens and parents to know is that if you do have a pain concern, if you do have a mental health concern, there are evidence-based treatments that can help. When it comes to mental health, for example, there are a lot of types of counseling and behavioral health support that have been shown to really help young people work through mental health concerns in a way that benefits them. There are medications to treat anxiety, depression, and pain, and do so in a way that doesn't involve opioids, that doesn't involve exposure to these risky counterfeit pills that are being sold. But the first step is to go to your pediatrician, and it's really incumbent on us as a pediatric workforce to help navigate families through this.
Thank you, Scott. And, you were talking about the first steps when there is a concern, when there's a pain concern or a mental health concern. Hina, I know you often speak publicly on your Instagram account and in other places about addressing the issue before it even starts. And that is giving parents and families tips around how to have conversations around substance use in general and fentanyl in particular. And I'd love to hear from you a little bit about how you recommend parents approach this topic, which is often very scary and nerve-wracking. Are we doing the right thing if we are bringing it up? When and how should we do that?
Yeah, so I think it feels and is a big scary topic. And there are a lot of big, scary topics that as parents of adolescents, we are incumbent to get into from time to time. So the whole thing feels really overwhelming. I invite, parents here who are listening or who are watching this later to even take this moment, this opportunity of you having spent time with us here today to go back to your teams and say, you know what? I attended a webinar or I read about National Fentanyl Awareness Day. And have you heard about fentanyl, or what do you know about it? Have your friends talked about it? And so you can use this moment or any moment in media when there is a tragic loss being shared, or whether it's being reported out in a different way about fentanyl. You can use those moments to open the conversation, because very frankly or very honestly, you can share with them, I didn't know about it, or I didn't know enough about it, or I thought I knew what it was, but I learned this. And so showing that you are learned something, or your eyes were opened on a particular part of this crisis with your teen can show that sort of your curiosity can be contagious to them, as opposed to necessarily just opening up a big lecture. But so finding that moment to start that conversation or to have this conversation, our advice is really, now is the time. Be opportunistic, find the time. We think we've seen enough data and we've heard enough from families that there is no time like the present to open up the conversation. Now, the type of conversation that you might have might be different based on if you have a younger adolescent or a high school aged adolescent or a college a student that or college age student that you are supporting. So you may come at it differently. But asking open-ended questions is always a great start. So again, what have you heard about fentanyl? Because this is what I just heard about it, is a great place to start. And then remembering that you don't have to have the big, scary full talk. It doesn't have to be an hour-long health, safety, wellness lecture. It can be a 1-minute talk. And actually 100 1-minute talks can be more powerful than one big, long lecture. So those are some starting points. Another thing, just to extend what Scott was saying earlier about about prescription medication pills. You know, sometimes with adolescents, it's more helpful to say what to do instead of what not to do. And so as pediatricians and as parents supporting teenagers, it's important to set the message that pills, medications are important and helpful. They're helpful in many different medical conditions and mental health conditions, but they should be taken as prescribed by a doctor. The safest pills are the pills, or the safest medications are those that are prescribed by your pediatrician or your family medicine doctor. And so setting that even at a very young age as sort of that's what's normal and what's safe, I think is an important pearl to drop.
Thank you so much, Hina. One thing you shared about how to have the conversation that I too recommend and have found very effective is to ask open-ended questions with teens. So rather than saying, have you heard about fentanyl, when they can easily just say, yeah or no, saying, what have you heard about fentanyl, which kind of opens the conversation up. And then further, after saying, what have you heard, stopping and just pausing and letting the teen respond, right? So there's really a chance to have an interaction.
Absolutely. And one other thing I will say that has been very helpful for me in speaking with teenagers is another tip is to ask about their friends first before you ask about them. It is much less threatening, it feels less invasive, and sometimes you get really interesting stories about what's going on in their social lives. So that's another sort of another way to approach it that may feel less direct, but can actually ask and then just listen. Like you said, you may hear some things that are helpful and will help kind of guide your next steps.
That's a really good point about friends. Not only giving attention to the friend relationships that are so important in adolescence as a way to open the door to a productive conversation, but I also often have friends who are other parents say, I can't or don't feel comfortable having the conversation in my own home, or I'm nervous about it, but I was forced to have this conversation because my teen came to me and said, I'm worried about a friend. And that's often actually how teens open the door to conversations around addiction and fentanyl in particular. What do you recommend, Hina, around parents having that particular conversation with their teens? What if they say, I'm worried about a friend?
I would say, I'm so proud of you for worrying about your friend, for caring about your friend, and for coming to me. And I'm so privileged and honored that you trust me. So thanking them and acknowledging their empathy and their caring relationship towards the people around them is where I would start. And then I would say, because oftentimes, we may not have the answers, but really showing them that if you have the answers, great, fantastic. Get them the answers if they have specific questions about it, about mental health or about substance use or about fentanyl in specific. If you don't have the answers, I think it's very important to say, I am in this with you. I am going to get the answers. I'm going to ask. We're going to speak to trusted resources, like your pediatrician or a mental health professional if we have to, but we're going to make a plan together, and I'm here for you and I'm here for your friend, and we're in this together. So I think giving them the sense of partnership and hope that things can get better and that there are resources out there for us to lean on are important messages as well.
Excellent. Thank you so much, Hina. Scott, I'd like to turn back to you. You talked in the beginning about naloxone as a life-saving treatment, and you recommended that all parents have naloxone in the home. I also actually saw that you recommended that on Twitter this morning too. All households should have naloxone. Some of us do, literally on our desks have naloxone. But I'm an addiction psychologist, and I'm not sure everyone knows where to get it, how to have it. Some people might be nervous about carrying a medication like naloxone in their home, or believe that it might not be relevant to them or their families. Can you talk a little bit about what your recommendations are around obtaining, having naloxone, and then how parents can talk to teens about what they should do in the case of an overdose?
Narcan is a key tool to help keep teens and families safe, and it's so easy to use. I mean, I think you just held it up, and if you were to flip it around for us to see, you could see that it's really just a nasal spray. Like, oh, sorry, it's in its box.
I'll take it out.
It's an easy to administer nasal spray that if you think someone's having an overdose, you just spray it up the nose. And it takes seconds. It reverses an overdose within minutes. It is extremely effective. And it's there it is. Thank you. And it's very safe to use. There's virtually no downside. So it is never the wrong answer to give someone Narcan or naloxone. Narcan is the brand name, naloxone is the generic name, if you're worried about them and think that they're experiencing an overdose. And so, families want to get Narcan to have it in their homes. What I do is I pick up a kit that has 2 of them in it. So each kit has 2 doses of Narcan in it. And I keep one in our family junk drawer at home where we keep our pencils and our rulers and our tape. It's in the central location. Anytime you need a thing, it's in that drawer. That's where we keep our Narcan. And then I keep another one with me in my backpack so that wherever I go, if there's someone out in the community that needs it, I'm ready to administer it. Families can get it now, starting today, right after this webinar. You could walk into your pharmacy and say, I want Narcan. And what states across the US have is what's called a standing order. So even though Narcan is a medication that needs a doctor's prescription currently, and I'll talk about how that's changing in a moment, there are these standing orders, meaning that if you go up to the pharmacist, they can give it to you in that moment, even though you don't have a doctor's prescription, they can dispense it under one of these standing orders and give it to you. And then it's typically covered by insurance. And in many cases, it's covered by insurance with a $0 copay, meaning that it's essentially free for you to pick up. And each kit has 2 in it. So you can do what I do, put one in the family junk drawer and then carry one around with yourself. And ideally parents will give one to their teens, and their teen is bringing it to, social gatherings and parties. I said I would talk a little bit about how this is changing. Narcan is actually going to become over the counter starting this summer. I was part of, I testified in front of the FDA in February in support of this policy, and the FDA has made the decision to make Narcan available over the counter. Unfortunately, the price of it is likely to be probably on the order of about $40 or $50. Which means that it will be expensive for many families. I know many of my patients and families quite simply can't afford that. And so these standing orders where you walk in and ask the pharmacist for Narcan will still be an important way for many people to get a hold of Narcan and have it with them. But more than this, it's not just enough to have Narcan, but you also need to know how to recognize the signs of an overdose. And so parents should know, and they should talk to their teens about what an overdose looks like. Someone will look sedated. They might be starting to slump over. They might be losing consciousness, or they might be unconscious altogether. Their breathing will slow or stop altogether, and their skin will start to look pale and white in color, and they might develop a little bit of bluishness around the lips as their oxygen levels drop down. And when you recognize those symptoms in a person, you immediately want to give them Narcan by spraying it up the nose, and then call 911 so that they get medical attention.
And Scott, what happens if Narcan is administered when someone is not having an overdose? Would you be concerned if someone is worried about a friend, but they aren't actually medically overdosing? Should folks be concerned, or should we be far more concerned about the opposite, which is the overdose?
Yeah, you should be much more concerned about the overdose, especially in teenagers. I really want to be crystal clear in the recommendation. It's never the wrong answer to give Narcan. Now, you also do want to call 911 so that person gets definitive medical attention. And that's for a couple of reasons. One is that a fentanyl overdose could last longer than the Narcan lasts. So Narcan can wear off after about 30 to 90 minutes. And somebody's overdose could resume once the Narcan wears off. So you want to make sure that medical attention has come. But if there's the second reason why is if there's another reason for that, that other teen being unconscious, let's say they were in a diabetic coma, or let's say they had used another drug, Narcan is not going to be dangerous to give in those situations. It's perfectly safe to do and never the wrong answer, but that person still needs definitive care for the other thing that's going on in that moment.
Thank you. And Hina, just if you have anything to add about your recommendations around Narcan or how you speak to parents and families about this.
We get asked often as pediatricians, what should be in your medicine cabinet at home? What emergency medicines should you have? And we often will say pain relievers and fever reducers and meds for allergies. This has become a medication that I routinely recommend now having in your home if you have an adolescent, a young adult, or anybody in your household that, well, really at this point, everybody. And so it's become a routine recommendation to have in your home. Now, we know you can have access to it by getting it from a pharmacy, but I also think it's important to think about where your adolescent is going. So I love what Scott said about they come in a pack of 2, keep one in the home, and consider sharing one with your adolescent to put in their backpack or to take with them. Schools are increasingly adopting having Narcan in the school system. And that's an area where parents can also, as a take home, go and speak to their schools after this talk to see, hey, what's our policy? Do we have access to Narcan in our school systems? And if we don't, why not? And let's talk about it. So I think that can be a helpful take home. But as adolescents are socializing, they socialize in many different places. So having it on them in their backpacks or in their dorms, wherever they go, if they're not living with you, it is important to really, really get the access down. And if you can use Flonase, which many, many children do, we've had a very high pollen index here in New York, you can use Narcan. It is not difficult at all. I think sometimes people think of that, like they think, oh, I can't, I wouldn't, but you really can. It really is very simple to use. It's not going to cause harm if you so happen to be wrong. And so we we strongly recommend it.
Excellent. Thank you so much. And I'd like to ask you each one more question, and then we've got to get to audience questions because they are pouring in. I'd like to talk about treatment. So what do you each recommend as resources that parents recommend if they're worried about an addiction or potential of overdose or addiction happening in their home or among their teens' friend communities or in their teens' school or broader community? Where can they go for resources around treatment, and who should they talk to?
Yeah, I think speaking to their pediatricians is something that I always suggest to families who are coming to me. Please speak to your pediatrician. They know you best. They know your family. They know your medical history. And so I think that when we do suspect, as sometimes we do, that there might be a mental health concern, to do as best as we can to get that young person connected to mental health support. Again, leaning on your pediatrician to do so. There's a lot your pediatrician can actually do to bridge that time between where you might be waiting. So I think those are two places that that in-person kind of conversation is really important. But there are some really great organizations and websites that we can recommend as well. And I'm sure we can share them out after, but drugfree.org is an incredibly helpful organization and website with a lot of great resources for parents. The National Fentanyl Awareness Day platform that brought us together today also has a tremendous amount of resources. Song for Charlie is another nonprofit that, again, is partnered with the platform today and has tremendous resources. I do want to shout out specifically Drop the F-Bomb, which was by the Ad Council. And it's this wonderful website that is really well laid out and designed and really answers educational questions about fentanyl and talks parents through talking to their teens, which people might be interested in today.
Thank you so much, Hina. And Scott, I wonder which resources you have to add.
Yeah, everything that Hina just said, and in particular, I really like drugfree.org. The Partnership to End Addiction is the formal name for the organization, and they just have a ton of resources that are directed towards parents and very evidence-based. And they also maintain a directory of treatment programs that parents can call, and these treatment programs have been sort of pre-vetted so that hopefully parents don't reach a lot of dead ends when they make phone calls using that directory. And I just want to sort of reiterate what Hina said about pediatricians being here to help. We have evidence-based, highly effective treatments for teens who have underlying depression or anxiety, teens who are experiencing pain, teens who are experiencing addiction. We can help with all of these things, and we just need to know about them. And so come to us. We're here to help.
Wonderful, thank you. I think that bridges to one of the questions that we've gotten from the audience around how can parents manage the fact that often teens who are using substances, perhaps problematically. They're starting to notice some addiction tendencies, consequences at home, at school. Their teen is changing and they want to do something to help. How do they handle the fact that that teen might not be open to having a conversation or to treatment itself? What do you recommend? And Scott, let's start with you.
Yeah, the first thing I would say is, to all my fellow parents out there, don't be afraid. This is part of what we're here to do. So I'm an addiction treatment specialist, and the majority of the young people who come to see me aren't quite ready to engage or accept treatment. And it's often their parents that have brought them in. And so part of the work that we and good drug treatment do is to navigate that ambivalence, to operate in exactly that space, recognizing that some teens really have to be brought in and aren't there sort of fully of their own volition. And it's my job as a good treatment provider to build the trust with the young person, to understand where they are, and understand what things I can offer them. Look, I always make the recommendation, because it's important for young people to hear this, that they cut back or reduce their substance use, because that's the healthiest thing. And yet I'm also there to operate in the space where they might not be ready, willing, or able to make that change in that moment. But there's often other things I can ally with them on, right? So they might not be ready to stop their substance use, but they might be really excited and engaged in a conversation about how I tell them they can keep themselves and their friends safe. They might be interested and excited about a conversation about how they can bring Narcan with them to parties to keep other people safe and empower them to do the right thing. Often cases, because I'm a primary care doctor, sometimes I ally with them on helping treat their acne, right? So, a good pediatrician and a good sort of treatment specialist will find the thing that helps you engage the young person. And so look for that and understand that we're used to dealing with this.
Excellent. And Hina, in the interest of time, I'm sure you have more to contribute, but there are a lot of questions and I want to make sure we get to as many as possible. I'd like to talk a little bit more about where we are seeing illicit fentanyl. Scott, in the beginning of the presentation, you mentioned that fentanyl is showing up in other substances, other illicit substances like cocaine or even cannabis, and also potentially prescription drugs like Adderall or Xanax, but ones in which folks are trying to obtain them illicitly through social media or other platforms. We have some specific questions about marijuana or cannabis in particular. Are you both seeing fentanyl show up in marijuana, in vaping, or in edibles, which are increasingly common among teens and the broader population, and especially in states where they're legalized? And what should parents and families know about this? Scott, go ahead.
Yeah, why don't I take this on? Because I want to be kind of really crystal clear about this so that the information is really accurate. The key place that we're seeing it, particularly for teens, is in these counterfeit pills. And teens should assume that any pill that hasn't been prescribed by a doctor and dispensed by a pharmacy is likely to contain fentanyl. And the US Drug Enforcement Administration tells us, the DEA tells us, that the majority of pills that are available for purchase right now in the illicit market contain an amount of fentanyl that is likely to kill a young person. And so teens should just assume, and parents should assume, that any pill that is not prescribed by a doctor contains fentanyl. But then there's other substances that have had fentanyl sort of incorporated into them, and then others that haven't. So I just want to be really clear about this too. There have been cases of, for example, cocaine being laced with fentanyl. And this is probably because on the same surfaces that people might be preparing cocaine in a lab somewhere, they might also be preparing fentanyl. And so the substances kind of get cross-contaminated. Fentanyl has shown up kind of everywhere in our heroin supply. So when somebody's buying heroin in the year 2023, in most places in the country, it's not pure heroin, it's actually heroin with a lot of fentanyl in it. But there are other places where fentanyl does not seem to have shown up, and I want to be really clear about this too. So although you will read news reports about cannabis and cannabis products being potentially laced with fentanyl, I want to exercise some caution because I don't want people to panic about this In the vast majority of cases, when follow-up studies have been done to understand, did that cannabis that somebody thought they overdosed on because there was fentanyl in it, did it actually contain fentanyl? In the vast majority of these cases, cannabis has been shown to not actually contain the fentanyl that people thought in the first place. And so I just want to reassure that the cannabis supply, although you will read some of these really concerning cases about cannabis being potentially spiked with fentanyl, in the vast majority of cases, this is not what's happening. So I want people to have the real facts here.
That's very helpful level setting. Thank you. Another thing we're hearing about a lot in the media and among social channels and parent communities is this idea of rainbow fentanyl, and fentanyl being disguised as candy, and that directly leading to overdoses. Hina, have you heard about this, and what might we recommend to parents around it? How can parents look out for this rainbow fentanyl?
Yeah, I've heard more about this from media reports than I have from reality. And so again, it's an area where I caution, and I think we should let Scott opine here as well. But it is an area that I don't necessarily perceive as a reason that, that adolescents are duped in any way from the coloring or the packages. It just doesn't, it's not true to the cases that I've been hearing, which is really more misuse of pills, or they're trying to self-treat themselves with a pill and they haven't ever yet had a pill, so they're prescribed to them, so they're getting it illicitly, or it's often really the first time that they're experimenting, and so that's what I'll say. But I'd love for Scott to chime in too.
Have you heard about this rainbow fentanyl, Scott?
Yeah, I completely agree with Hina. I won't add much because everything she just said was totally spot on. I would say, sure, yes, we as pediatricians do worry whenever something that's potentially dangerous gets packaged in such a way that it could be appealing to youth. But I think that probably a lot of the concerns around rainbow fentanyl and its sort of specific marketing to youth may have been a little bit overblown. I think we just need to be concerned about fentanyl writ large in all of its forms. And rainbow fentanyl is probably some part of that bigger concern, but it's not the central concern.
Thank you. And there's a question about something you both have shared today around fentanyl overdoses among teens, primarily happening in our homes. Can you talk a little bit about that? Why specifically it might be happening at home? That is a little different from what we might imagine is the common teen substance use experience, which can potentially be a bit more social. And we're talking about, bringing Narcan to parties, but it doesn't seem like overdoses are happening in social settings like parties as often. So can you just talk a little bit more about why exactly it seems to be that overdoses are happening in the home? Hina, you kind of highlighted a little bit around teens using alone and teens using in response to pain of various sorts, whether it be physical or mental health. What might parents need to understand a little better to look out for this in our homes?
Yeah, I think that it's extra tragic when you know after that family members were close by during a death like this. But we also know that that adolescents do use alone. I think Scott highlighted earlier that is one of our harm reduction recommendations, is to not use alone. But we're in, and as our Surgeon General highlighted recently, an epidemic of loneliness, and there have been alterations to how adolescents have socialized in the last couple of years, and for that reason, and for many reasons, that it's very normal to hear of adolescents using in their homes, in their basements, in their garages, in their backyards, in spaces in their home where they are either alone or with one or two peers. Sometimes parents know that there is substance use happening in their home. Most of the time they don't. And so I don't think, we're not here to judge. We're not here to make we feel bad about it, but it is important to level set on whether we are permissive about these things, and whether whether we've talked about harm reduction also, and safety also. And if not yet permissive, or if not yet it hasn't occurred, to think about sort of declaring your home, or your your home and the spaces where teens may come to visit, drug-free spaces. And that's sort of that's the intention, that's the value, that's what the expectation is. That's what we think is the safest. But once it's already started, it's harder to walk this back. So again, depending on the age of your children, when you're listening to this, you may hear this differently. But yes, there's many reasons why adolescents would be using alone at home. And I think it also just goes back to stepping back. Like, we're here to talk about fentanyl. It's National Fentanyl Awareness Day. But this is also a big part of just talking about adolescents and their mental health, us checking in with them, us being aware of their struggles or what they might be going through, us knowing how serious it is and feeling like, whether this is normal adolescent behavior or whether this is something that we need to get help on. And so zooming out and having those check-ins about their mental health and staying ahead of that is, an equally important part of this conversation.
Thank you for bringing it back. As a fellow health professional and mental health professional, I too advocate so strongly for having early conversations about mental health and the relationship between mental health and substance use, specifically during the teen years. Scott, I would love to hear if you have any thoughts, either more specifically around what we're seeing of the phenomenon of opioid or fentanyl use specifically in the home, or that broader kind of stepped back conversation that Hina started around how parents can broadly be viewing substance use and mental health issues for teens today. How's that for a big question? You're muted.
To put a positive spin on this, I should highlight that the vast majority of teens are healthy, are doing well, aren't struggling through mental health problems, aren't using substances. And I think we don't talk enough about these public health successes, and we don't give our teens enough credit for really thriving in a world in which, because of a lot of things that we adults have done, and because of the circumstances of the recent pandemic and other things that are going on, that we put a lot of stressors on them, and yet they're doing quite well in aggregate. But as Hina just highlighted, we need to be having these conversations, because even teens who are doing well can experiment with substances, could experiment with a pill that contains fentanyl. And some teens are struggling with mental health problems or struggling with addiction, and we need to be available to them. When it comes to drug and alcohol use, it is not effective for me as a pediatrician to drug test kids, or for parents to try to catch their kids by drug testing them, or to sort of be sneaky about it. It's actually much, much, much more effective when we just have the open conversation, when we create the safe space to talk about this stuff, when we approach from a place of curiosity, and we create the context in which a young person feels much more open and sort of ready to share what's on their mind and what they know.
I wonder too if, based on what you said earlier, of giving teens credit for the incredible amount of resilience that they are experiencing as a generation today, coming out of the pandemic and just dealing with so many big challenges that we didn't have to deal with when we were that age, and how they have really, in many ways, successfully been able to navigate those challenges. I wonder if a conversation around substance use and fentanyl in particular might start with praising teens for everything that they've been through, noticing and seeing their strengths, and acknowledging that while there are challenges, we believe that they are doing their best to manage them successfully. All right, well, we're getting toward the top of the hour. And because of that, I would love to give you each a chance to share some final words with the parents, families, and community members who are on this webinar today. What is something that either you didn't get a chance to share earlier, or one of the most important things that you said or heard from the other panelists today that you would like parents to remember if they can remember one thing? Hina, I'll start with you.
There is no time like the present or today to start the conversation with your adolescent, to check in with them. Use today's Awareness Day as a moment as an opening, as an invitation to ask your adolescent, what have you heard about fentanyl? I think that you've taken this time to be with us today. You know, it's helpful to go and act on it. So that would be the number one. And number two, consider getting Narcan in your household. You know, we are seeing it we are seeing these deaths by overdose and poisoning in large enough numbers in this age group that our eyes are literally coming out of our heads. And we need to all work together to help protect our adolescents. And so this is one thing, this is one tool that is life-saving. It's available. We just need to get it in the hands of families and of those who are around this age group that we love so much. So see about getting it, see about if it's in your school, ask if it's not, if they're where they are in the process, because I'm sure they've been talking about it. And lastly, this is about safety and mental health, which is, those are values that I think your adolescents and young people align with you on, even if you feel like they may not. They really do, especially when you're coming at them with the authenticity about, this is sort of out of our hands. It's in the drug supply. It's there for a reason because it's cheaper, it's tainted. It's, they can really get on the bandwagon of, oh, this is a threat, and that it's out there and it's real. And align with them on it. And I have seen conversations go really well within families when they're on the same team, sort of against this big problem, and not that they're coming at it from two different sides. And we are here for you. Please talk to your pediatricians.
Thanks so much, Hina. And Scott, what would you like to share with parents as we close today?
Yeah, two quick tips. First of all, the number one argument that I hear when I tell folks to go out and get Narcan and have it on hand is people will say, well, if you make Narcan available to teens, aren't they just going to use more drugs because now they know it's safe? And I want to debunk that, right? So this is what we said, 20 years ago when people wanted to put condoms in school bathrooms. We said, if we give teens condoms, they're going to have more sex. Well, the studies have been done. That's not what happens. All that happens is that teens who might have already been doing that thing that we're worried about now do it more safely. So everybody should get access to Narcan. And that really brings me to the second thing I want to leave folks with, and that is, how can you get Narcan today? So after this webinar finishes, if you've got a lunch break or you've got a moment right now, call your pharmacy, dial 1 or 9 or whatever it is to get to the pharmacist on the phone and say, hi, my name is Scott, and I'm looking to get a prescription for Narcan under the standing order. Use those words. And they should then take your information, your full name, your date of birth, and prescribe you or give you Narcan for you to pick up the next time that you're able to get over to the pharmacy. It's really that easy. Now, some families have told me that they'll go to the pharmacy and say they want to pick up Narcan, and a pharmacist will say, well, why? And all you have to do is say, because I want to save someone's life if somebody ever overdoses, and just say it with pride, and just work through that stigma, and just get yourself Narcan, and then use it as a basis for a conversation that you then have with your teen. Hold it up and say, look what I got today. I would just love to talk to you about this and how we can be safe as a family.
Thank you so much, Scott. Thank you, Hina. It's been an absolute pleasure to spend this time with you both today. I, as a parent, feel like I got more practical tips, and I'm sure the folks out there did as well. As a reminder to everyone in the webinar, this session was recorded. You'll receive an update via email once the files are available with the recorded session. And you'll be able to get the recordings free of cost on the websites of the National Fentanyl Awareness Day and its partner Song for Charlie. Stay tuned for additional resources, the ones our experts mentioned and others, as well as updates and a survey for your feedback today. Thank you so much for joining us, and don't forget to spread the word today.